Why does acetaminophen, also known as Tylenol, cause liver failure at high doses? This is one of the most important high-yield concepts that will be tested on the USMLE, so let me break it down. I'll start by asking you a question first. What enzyme system metabolizes acetaminophen and what toxic metabolite does it produce? Because if you understand this, the whole mechanism will make sense. All right, so normally when you take acetaminophen, about 90% gets metabolized safely through glucuronidation and sulfation in the liver, and these two mechanisms are harmless and the metabolites get excreted in the urine. Only about 5 to 10% goes through the chromosome P450 system, specifically CYP2E1, which converts acetaminophen into a toxic metabolite called as NAPQI. Now here's the key. NAPQ is extremely reactive and will destroy hepatocytes, but normally it gets immediately neutralized by glutathione. Glutathione conjugates NAPQ, makes it harmless, and it's excreted. So at normal doses, the small amount of NAPQ produced is easily handled by your glutathione stores. Now here's where overdose becomes dangerous. When you take too much acetaminophen, the safe pathways, the glucuronidation and the sulfation pathways will become saturated. They can't keep up. So more and more acetaminophen gets shunted through the CYP2E1 system, producing massive amounts of toxic metabolite NAPQ. Eventually, glutathione stores get completely depleted and now NAPQ accumulates with nothing to neutralize it. The NAPQ directly attacks hepatocytes, causing oxidative damage and centrilobular necrosis. That is, the area around the central vein dies first because that's where CYP40 concentration is highest. Now, many students will say, what's the antidote? N-acetylcysteine or NAC. It works by replenishing glutathione stores so you can neutralize NAPQ again. The earlier you give it, the better, ideally within 8 hours of ingestion. And here's the clinical pearl. Alcoholics and patients on drugs that induce CYP2E1 are at higher risk because they produce more NAPQ at lower doses. And malnourished patients have lower baseline glutathione. So the safe dose isn't safe for everyone.